Now, x-rays. We talked about the history given to us by the patient. We talked about the physical examination findings. What about x-ray? Well, in most cases, x-rays are negative, which means that they are normal. They don't show us the ligament tear itself or the ligament injury unless there's an associated fracture. Sometimes there can be fractures associated with ACL injury, and that's where x-ray may come in handy. There's a sign we call the deep sulcus sign, which may show a depression in the distal aspect of the thigh bone. Distal means the far end of the thigh bone, which would be indicative of a depression in the lateral femoral condyle. Remember, lateral, outside of the knee, femur, thigh bone. Condyle is the distal or the end portion of the thigh bone where it meets the shin bone. All right, we talked about MRI. When we look for MRI, this particular picture here, you can see this is what we call a coronal view. MRIs are done in slices. So in this particular MRI, imagine the MRI machine slicing your body from anterior to posterior or front to back. So the image that you're looking at here is a coronal view of an MRI showing something that we call the empty notch sign. You can see the arrow, the green arrow there pointing to an empty notch because the ACL should be located in that notch. And in this particular picture, there is no ACL present. This MRI here is what we call a coronal view. Excuse me, not a coronal view. This is a sagittal view. Now imagine the MRI machine slicing, let's say hypothetically, from left to right. And so we're looking at a knee through what we call the sagittal view. And you can see the arrows here pointing out bruises in the bone in association with this particular patient having had an ACL rupture. So MRIs are very helpful, not just to show us the ACL injury. It can also show us bruises in the bone, and it's quite detailed here. So this patient had a very traumatic knee injury.